Good afternoon. I have good news to report today. We're seeing a decrease in our COVID case counts and in the percent of people testing positive. Here are the numbers. Since this time yesterday, we've identified 85 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 33,139 since the beginning of the epidemic. Now, for the past week that ended last Saturday, August 22nd, by the date at which the test was run, we averaged 98 cases per day. That's the lowest weekly average we've had yet, and the first time we've been below 100. Now, that number is likely to rise a little bit because some laboratories are late in reporting their data to us. That is still very good news. Also, last week, we averaged 3.4% of people who were testing positive. That also is the lowest number we've had yet. The week before that, it was 4.1% positive. So I really like that trend in the downward direction. Since yesterday, we've identified no additional deaths from the infection, a total of 1,736 since the beginning of the epidemic. Our data on deaths comes in batches, but we're averaging about 1 to 2 deaths per day. Now, an update on testing. Last week, we tested 2,860 people per day on average. And we expect that number to rise a little bit with late reports. We are seeing some improvement in the delays in getting test results information back to people. Across all the sites in the city right now, people are getting the results back in 1.3 days on average. There is still one laboratory, the one called Quest, that is slow and is reporting their results in 4.2 days. Most people are getting the results back pretty quickly. We have updated the map on our website about where you can get tested with a lot of additional information, including where children can be tested. And that website is www.phila.gov/testing. Now, we've also been tracking data on mask use. We were observing masks in people exiting retail stores and in people in indoor SEPTA stations. And we had that data on a graph that we posted on our website, and we combined the data from retail stores and SEPTA stations in that graph. The percent people wearing masks was increasing in both settings, and that was good. But in the past few weeks, SEPTA has had some IT problems, which you may have heard of. And so in recent weeks, we've had no access to the SEPTA data. So we're now just going to be reporting data for people exiting retail stores. And for last week, the week that started on the 17th, 88% of people observed were wearing a mask. And that's an increase from 77% the week of July 27th. So clearly a trend in the right direction, not quite at 90%, but we want to be up at 90%. That's where we are in Philadelphia. Now in Pennsylvania as a whole, case counts are also falling. They've been falling about 4 weeks since late July. That's around the time that Governor Wolf signed his targeted mitigation order, which closed bars and limited indoor and outdoor gatherings. And I don't think those two are connected. Now in the US as a whole, case counts are still high, but they're also falling. They're falling for about 5 weeks now. And I believe that's the result of mask requirements in other parts of the country and other safety requirements, including closure of bars in many areas. But I do want to point out that this improvement in the epidemic isn't inevitable. In fact, in Europe right now, case rates are rising. And surprisingly, Philadelphia now has lower rates of this infection than Spain or France. The lesson is that we still need to follow the safety guidelines, especially masks. If we don't follow the safety guidelines, this virus could clearly come back. So that's where we are in Philadelphia. Our plans for the future are for reopening on September 8th, and we're still on track for that. So as of September 8th, the day after Labor Day, we will allow indoor dining with restrictions, and we will allow theaters to open up likewise with restrictions. There are continuing restrictions in other areas, so we will not be allowing the opening of nightclubs or conferences and conventions or senior centers. Indoor gatherings are still capped at 25 persons, and outdoor gatherings are capped at 50 persons. Also, I want to just remind people of what we're learning from our case interviews when we do our contact tracing about where this virus is most likely to be spread. It's mainly spread right now in Philadelphia among household members, among relatives, including relatives from other households, and among social gatherings with friends, including very small gatherings of just a few people, and with travel and a group of people getting together and getting in a car together where there's people in close proximity and they can spread it in the car. So the lesson is that the people you trust the most are the ones that you're most likely to catch the infection from. Those are the ones that you're around, those are the ones you get close to, and those are the ones that typically people don't wear masks with. So you should trust those people, your relatives and your close friends in general, but not with COVID. So you should wear a mask when you're near your relatives and your friends. You should wear one at home when others are in the same room. and wear one when you visit others in their homes. This is especially important for people who are medically vulnerable, people over the age of 65 or people with chronic medical condition. Really, if you're in those situations, you should avoid contact with even relatives and caregivers that are out and about unless they're wearing a mask and you are also wearing a mask. For more information on where we're at with COVID, just go to our website, www.phila.gov/COVID. Thanks.
Hey everybody, just 3 questions from our team today. Number one, for Dr. Farley, asking about the college reopenings. I know that we covered Temple University reopening yesterday. Just wondering if there's any general concern about, that number of students all, getting together and around COVID concerns. We've seen other college campuses around the nation have to close after upticks.
Certainly, we're concerned about any of the colleges where they're bringing a bunch of students at one time. We worked with the colleges around their safety plans starting back in July. They have, I think, strong safety plans for the things that they can clearly control. What happens in the classroom and things that happen on campus. It's far more difficult for them to address safety in areas they don't control, or if students are having a party off campus and a bunch get together. We asked them to do what they could on that and to message the right things. And we're going to be in close communication with them. And if we see a real problem with that, we'll see if we have to act. So far, so good. But we are, absolutely are concerned.
All right. Thank you.
Hey, good afternoon, everyone. I have a couple questions for Dr. Farley on testing. So some private testing sites in Philly have been announcing that they're rolling out the 15-minute antigen tests, the rapid tests. I know you previously said you were worried about false negatives from that kind of test. I'm wondering if your opinion on that has changed at all, or whether you think it might help mitigate testing delays in the city.
I'm still worried about false negatives. There may be a role for this. I'm not saying that they shouldn't do that, but I think they need to be very careful. For somebody who has symptoms or has a high likelihood of being positive, if they get a negative result, they need to have a regular test done to be sure that they're in fact negative. And so it needs to be done very carefully.
What would you say to people who are maybe going to get the test now that it's more widely available? How would you advise regular Philadelphians?
Well, I would advise them to just that if you have some reason to think that you are moderately high risk and you have a negative result, you better make sure you get a regular test, a PCR test, to be sure that you're in fact negative, because you don't want to assume that you're negative and be positive and then pass the infection on to other people as a result of that.
Right. Okay, just one more question. I've read that the city plans to implement, Billy Penn reported that we planned to implement rapid testing at some city health centers in May. I'm wondering what ever happened with that.
There was the Abbott ID Now machine that came out that did, we evaluated how effective it was. It did give rapid results. It also gave a lot of false negative results. And so it got to the point where we didn't feel it was worth it. We essentially would have to repeat the test for almost everybody. And so I'm not sure if there's any of them that are still offering that test now, but it's not something that we're enthusiastic about because of the poor accuracy.
Got it. Okay. So no plans for rapid testing at any of the city sites anytime soon?
Not now. We're still awaiting a rapid test that has a high degree of accuracy, in which case then we would be very enthusiastic about rolling it out. But right now we haven't seen one.
Got it. Thank you so much.
Hello, this is for Dr. Farley. So are you saying that people should wear masks even when they're at home with family members who they live with?
If they're at home with family members they live with and they're not medically vulnerable, they don't need to wear a mask. However, if they're medically vulnerable, over the age of 65, or have a chronic medical condition, and their household members are out and about, and so that household members may be exposed, then there's a risk and they may be exposed from those household members. In that case, they should. And I know that may feel like a lot to do, but for people who are medically vulnerable, this can be quite a serious infection. We are recommending that people who are visiting relatives who may live in a different house or close friends, that they wear a mask.
Thank you. Quick question for Dr. Farley. Dr. Farley, have you been tracking what's been going on with nitric oxide gas in treatment of COVID?
I have not heard about that.
Okay. The second question is, can you explain what the president was able to do to get approved when it comes to blood, plasma, and the treatment of COVID?
Yeah, so people who have had COVID infection have antibodies after they recover. And so people have used that, the serum, the fraction of the blood that has those antibodies, and have administered that to people who have a new infection in the hopes that the antibodies in that blood might be able to reduce the severity of the infection in the people who are newly infected. That has been available through a study protocol that was coordinated by the Mayo Clinic for some number of months now. What happened yesterday or the day before, I forget, was that the FDA announced with the president there that they would have emergency use authorization, which makes it easier for physicians who want to use that treatment to use that for their patients. They need to get approval from the FDA, but it's a fairly streamlined approval process. It doesn't say that that treatment is proven to work. It does say it's an emergency, and if you have a patient that's in dire straits and you feel as a physician that the patient should get that treatment, that there's a mechanism for you to get that.
Hi. First, I have a question for Dr. Farley. You mentioned that the weekly average of 98 cases for the week that ended Saturday was the lowest weekly average yet. I was just hoping to clarify, that is since when?
Yeah, to clarify that, that's really since the epidemic peaked back in April. And in the first week or two of March, when we first saw this, we would be lower than that. But it very rapidly got above 100 cases a day. And so it's since that time.
Okay, thanks. And another question, you mentioned that, the city is not yet able to allow nightclubs to reopen or conferences to resume. As far as activities, would you anticipate the city reaching a point where that could resume prior to us really having a vaccine or, all of this being over?
I'd say it's possible. I'm not going to put a timeline on it, number one. And number two, some of those restrictions are from the governor's order, and some of those are from the cities. And so the city cannot roll back any restrictions that the governor has. That would have to come from him.
Hi, I have one quick question for Dr. Farley. I know you said last week that it was still very unlikely to have fans in the stands for Eagles games. I was wondering if there was any update on that, or if there was any date that you could provide just to give a final answer.
We are coordinating that discussion with the governor's office. So I can't give you a specific date on that. I certainly think it'd be very unlikely that there would be fans in the stands at the opening.